Hi, I'm Becky, DPT. Today I want to discuss with you the difference between tendinitis and tendinosis. So the first thing we need to understand is a tendon is what attaches a muscle belly to the bone. So you have a muscle, and then on each side there is a tendon that attaches that muscle to the bone. So if there's an issue with a tendon, it's tendinopathy. Tendinitis is actually when you inflame one of those tendons, one of those attachments to the bone. It's normally very acute, it's quick, maybe it happened from a fall, or maybe you were lifting improperly and it kind of tweaked one of your tendons. We have tendons all over the body. Tendinosis is when you have a degeneration of the tendon or a breakdown of that tendon where it kind of degenerates and it has these little frays because it's been worn away just a bit. And it happens, like I say, over time. So it's not as quick as when you have tendinitis. That's a quick onset. Tendinosis, it happens over time and there's breakdown there. So there's not as much stability. Pain is present in both. Pain with tendinitis is normally very sharp. Pain with tendinosis is more of a dull, constant, and with activity, it becomes very painful. With tendinitis, there is a lot of swelling normally. With tendinosis, sometimes you can have swelling, but it doesn't always have to be present. For treatments, for both of them, ice is very good, rest is very good, anti-inflammatories, but the one main thing that is really good for tendinosis is eccentric contractions. When we perform an exercise, for my bicep, I concentrically contract, so I shorten that bicep up whenever I do a curl. But then whenever I lengthen into that bicep, that is that eccentric contraction. So a shortening phase is concentric, a lengthening phase is eccentric, and that's where you need to focus, and that helps to really heal up whatever tendon you're having an issue with. Tendons are all over the body. Anywhere you have a muscle, you have those tendons coming out. That bicep, you have those tendons, that origination site and that distal site where it attaches. Our patellar tendon is a very common area. The quad comes down, or our group of quads come down, and they attach into that patellar tendon. This is a very common spot. So again, for that quad, if you were doing leg extensions, the most important is that lengthening phase. So not as you concentrically contract that quad, but eccentrically. Same thing for such as a squat. We would squat concentrically and then eccentrically. That's the most important part. So we wouldn't want to come down here and throw that weight up. We would want to control it on the way up as we lengthen that muscle. Hopefully this helps distinguish tendinitis versus tendinosis to treat things just a little bit differently. Have a great day.